everybody. Welcome back to Health Record Systems and Issues. This is lesson lesson 9, and we are going to be discussing the electronic health record, and we're going to break this into 2 lessons. We'll also cover that for next week and or in the next lesson. But for this lesson, we're going to just kind of do an overview of it. And then in our next lesson, we'll delve in a little bit deeper. As an introduction, we need to talk about the American Recovery and Reinvestment Act. That's ARA is what some people call it. It was created in 2009 or went into effect, and it has a definition of a qualified EHR. And these next few slides, we're going to be talking about the different definitions of an EHR from various organizations. The American Recovery and Reinvestment Act defines a qualified EHR as including patient demographic and clinical health information such as medical history and problem list, and has the capacity to provide clinical decision support by physician order entry, capture and query information relevant to the healthcare quality, and exchange of health information with and integrate such information from other sources. Okay, now I do want you to kind of look at these different definitions, and there are some similarities, but there are some little differences too. A computer-based patient record. Now remember, that was electronic health record. This is a computer-based patient record, excuse me, according to the Institute of Medicine's definition. And this is a system specifically designed to support users through availability of complete and accurate data, practitioner reminders and alerts, clinical decision support, links to bodies of medical knowledge, and other aids. Okay, so now we have 2 different definitions that is they're close, but they're worded a little differently, right? So we're saying that an electronic medical record is a system that integrates dictation, transcription, scanned documents, and print files. Okay? Along with the National Alliance for Health Information Technology, the NAHIT, says an electronic medical record. Notice that this first definition is for an electronic medical record, and then the second one is for an electronic health record. And let's look at the medical record first. An electronic record of health-related information on an individual that can be created, gathered, managed, and consulted by authorized clinicians and staff within one healthcare organization. That's an electronic medical record, the EMR, and that's their definition. The electronic health record, the EHR, they say, is an electronic record of health-related information on an individual that conforms to nationally recognized interoperability standards and that can be created, managed, and consulted by authorized clinicians and staff across more than one healthcare organization. You see the difference there? They're saying the electronic medical record is within one healthcare organization, but the electronic health record, the EHR, is on more than one healthcare organization. So now you see why we needed to really kind of get these definitions out of the way, because there's little small differences that really kind of mean a lot, right? Health information technology is the term that's used to describe the use of information technology in healthcare. That is kind of common sense, I think. So the goal of the EHR, the electronic health record, do we need to go back to that slide? Remember the difference. Electronic health records, they provide seamless exchange of information, access to evidence-based medicine, and have embedded clinical terminology. Okay? Now remember, the EHR is the one that can be shared across more than one organization. The electronic health record system, underline that word system, has EHR applications like point of care chart. That would be like a laptop or whatever, right there by the bedside of the patient or in the room at the clinic where the physician goes in to see the patient. That he'll either, or the nurse, one or the other, will bring in a laptop if there's not one already in there, and they will then record their progress notes and all of that in the record at the patient's bedside, at the point of care. That's what that means. Okay? Wherever they're caring for the patient, they can also do the charting on that patient. Computerized provider order entry, such as ordering medication. Okay, CPOE is what that's called, computerized provider order entry. Some organizations or records will call it computerized physician order entry. Okay, so you can look at it that way. Electronic medication administration record. This is the MAR. Okay, electronic MAR, medication administration record. That's any time a patient is given medication, it's recorded on that medication administration record, and what the time and the date and who gave it to them and etc. is all recorded in there. Clinical decision support. This is so that it will help make those medical decisions, be able to typically consult medical references, medical dictionary, medical I just went blank. The physician's desk reference, where they can look up different things, look up information on medications or whatever, and it will also have those flags in there to help with decision support, like the medication is ordered that's contraindicated with another medication, then it will send up a red flag, or maybe the patient is allergic to that. It'll send up a flag, okay? Then ancillary systems would be like in the other ancillary supporting departments. Picture archiving and communication systems, and the health information exchange, so that it can be exchanged within the organization, but also eventually be exchanged with our state network and for health information. And also, they're hoping to get that started nationally and for everyone, everywhere, health-wise, to be connected. And if they have, if they're authorized, then they can access that patient's information from wherever. Okay. Practice management system, that's exactly what it says. It's for physician practice, right? And it helps them with scheduling and the financial side of things, and the inventory control and the billing and the reimbursement, etc. Okay? E-prescribing, we've already talked about that. Okay, Health Level 7 EHR Systems Functional Model. It lists the functions for an EHR. For this lesson, we'll delve into it deeper in our next lesson, but for right now, we're just going to kind of leave it at that. Clinical decision support. As I said, it assists physicians, nurses, and other clinicians in making decisions about patient care. Okay, it provides that documentation of clinical finding and procedures. It has active reminders for medication administration. It suggests or makes suggestions for prescribing. It has protocols for certain health maintenance procedures. And it has an alert that a duplicate lab test is being ordered. It won't be reordered needlessly, wasting time, energy, and money. Clinical decision support, the data must be captured in discrete data. This would be structured data. Some examples would be lab values or medication data, dosage data. Okay, so you kind of understand what that means, right? Continuity of care. You'll hear that over and over and over in this program, and you'll also be hearing it get out into the real world working in HIM. There are continuity of care standards. I'll get it out in a minute. This is a standard format for data that's needed for patient referrals, okay? And it's developed to eliminate data inconsistencies. Then we have ASTM, and that's the Continuity of Care Record Standard, okay? The CCR, Continuity of Care Record Standard. And HL7 is Clinical Document Architecture. And together, the Continuity of Care Record and the Clinical Data Architecture is the Continuity of Care document. Does that make sense? Together, that's what they're referred to. And then the continuity of care record is a subset of the electronic health record. Can we make it any more complex? Just joking. Quality measurement and reporting. And we won't go into a whole lot of detail on the quality measurement and reporting because you will have a quality course. And I know you look forward to that one as a senior. But for now, we're going to say the federal government promotes the EHR to improve healthcare quality, efficiency, and patient safety. Remember our report to err is human. Okay. CMS provides hospitals who report designated quality measures higher update to their payment rate. And reporting hospital quality data for annual payment update. And talk about a long acronym for a program. I think that I would probably just have to say it out because I would probably get my letters of the acronym confused. How about you? RHQDAPU? Woo! Then collecting data has been a burden for this type of reporting for a long time, okay? Physician Quality Reporting Initiative, PQRI, that's an incentive pay program and it now includes e-prescribing, and it's the basis of high-tech incentives. The evolution of the electronic health record, we've already kind of talked about it, so this is just a real kind of quick overview because you may be asked some of this stuff on the RHIT exam after you graduate and throughout, okay, the program. So you need to know it. The earliest efforts began in mid-1960s, and clinical data are textual, right, and contextual. Remember that we're talking about the electronic health record, okay? In the 1980s, the Institute of Medicine recommended new technologies and said they needed to improve the state of medical records. Remember back then, we still had paper records, okay? And the quality of care and patient safety can be improved. They've done studies to prove that. Document management systems. Now, if you are in the Applied Systems course this semester, which a few of you are, you might be pretty familiar with document management systems already. But remember in this course, we're kind of doing more of an overview here. So the document management system is for document imaging and is now called the document management system, okay? It used to be document imaging. So we have the electronic document management system now. And this is to show you how things have kind of changed over time. Well, the computer output to laser disk, COLD, computer output to laser disk. And Unless something's changed, they still ask about this on the RHIT exam, so you do kind of need to know it. Now it's called Electronic Report Management Systems, ERM, okay? And then electronic document and it handles the electronic document and content management. And then there is workflow changes when you have a document management system. Because think about it, you're going from paper to an electronic form and you're imaging that. Document management systems have electronic signature authentication. That's where they can sign it electronically using their electronic signature code. And there's a digital dictation system and speech recognition. The stages of an EHR. You have the clinical data repository. Clinical data repository is a database, and it manages data from different sources, and it allows for easier processing. Okay? I know if you're asked a question about a CDR, a clinical data repository, you'll be able to tell me that, right? Point of care charting. This is the beginning point of many hospitals. They have templates that are used to collect the appropriate data to make sure it's kind of entered and they have everything they need. They use data collection tools like checkboxes and drop-down menus and things like that in order to speed it up a little bit. The logic is built in and it follows practice guidelines. Practice meaning in the medical practice or that specialty's guidelines. It has knowledge databases that are accessible to help. And practice guidelines versus evidence-based guidance are both within there. Nursing, medication administration, and provider order entry applications. Many facilities start implementing an EHR by implementing the nursing documentation first. You have the electronic medication administration record. That's typically done by the nurse and the pharmacy. Computerized provider order entry. They do the where they enter the order for the prescriptions or whatever. That's the standard order sets, and it has standard order sets, and it's got like clinical decision support built in. There's barcode medication administration record. Remember that we talked about scanning the patient's armband because there are barcodes on there now, and then scanning the medication, and that way they know they're giving the correct medication to the correct patient, and it documents the date, time, and who administered the medication. It's closed loop medication management. Computerized provider order entry in the ambulatory environment. A CPOE is what that is called, okay? computerized provider order entry. And yes, a good thing to know that because you're going to see it over and over and hear it over and over. CPOE is a part of the EHR, but it has fewer destination systems. Medication orders are usually posted through e-prescribing, and I know whenever I go see my physician, he sends the prescription directly to my pharmacy by going into his laptop there in the office. Transition state. We know that the EHR is still being implemented. It's not everywhere. Right now, you're going to find that a hybrid record is more common. However, there are some issues with the hybrid record, such as identification of health information, location, and accessibility. These are just issues that come up that have to be addressed. Printing issues. Number one, who can print, where they can print, making sure that you have an audit trail of who is accessing what and printing what and where they're printing it and why. Release of information coordination, because you want to try to keep release of information to a confined area and in the department, because if they are if they can go anywhere within the facility and get a copy of the record or get information released, then that you have less control, okay? And you're basically just asking for a HIPAA violation to happen, because you have to really keep control over it and have those audit trails in place. Identification of users, identification of the legal health record is another one. Not everything that is in the record is considered the legal health record, because if you have copies of records from another facility, you cannot legally release those. They have to go to that facility to get those, okay? I know it sounds confusing, but there's a reason. Again, audit trails. If we release another facility's information on a patient, then how are they going to know where that information went? Okay, we are responsible. Okay, are custodians of the record is what you'll hear over and over. Identification of designated record set. Okay. We're still transitioning because many organizations still print everything. You'll find that in a lot of physicians' office even, they still print everything. They have those paper records. They may or may not have an electronic version. In some organizations, they scan all the paper documents, and that's what they consider theirs. But it originates, and then they have to decide, okay, do we keep the paper documents permanently, or do we store them for a certain period of time? Or, those decisions and policies and procedures have to be made and followed. Initiatives and framework for the EHR. Remember, the EHR is different from the EMR, because the EHR, we want to be able to exchange health information with other healthcare organizations, okay, if they are authorized. The federal government has initiatives. We have HIPAA, right? The Health Insurance Portability and Accountability Act. And remember, HIPAA is HIPAA, two A's, not two P's, two A's. And then we have the Office of the National Coordinator, which is the ONC. And we have initiatives from the Health Information Technology for Economic and Clinical Health Act. And they call that the HITECH Act. A lot easier to say. The ONC, this is the Health Information Exchange, is what they are over. And there's, we're talking about the national, you've got national, and then you have regional and state levels. Okay, so they are the ones over the Health Information Exchange, the HIE, and there's different models of the HIE. One is federated and consolidated, okay? And the HIE requires policies and procedures for exchanging health information. It has security utilities, a matching algorithm, and record locator service. The ONC supports nationwide the Nationwide Health Information Network, and would support national health information infrastructure once it's created. The HITECH Act, okay, it made the ONC permanent. Before it was just kind of temporary, now it's permanent. The focus on the EHR with the PHR, that's the personal health record, and HIE, what does that stand for? Health Information Exchange, being the key elements. And then we have meaningful use. And that's the ability to demonstrate quality improvement through the use of EHR. And when meaningful use went into effect, there were different phases, and you had to achieve certain things and be able to provide proof of that by certain deadlines, and then you would get kind of reimbursed funds for your electronic health record if you implemented one, okay? But you had to show and be able to demonstrate that quality improvement, and it would list off what you, the things that you could choose from to report, okay? So at different phases, you were supposed to show different phases of implementation, okay? That was an extremely simplified view of meaningful use. Local efforts and challenges. The EHR vendors may not be able to keep up with demand. They have to have challenges meeting the HL7 EHR system functional requirements. They have to meet the interoperability. I'm really having a time pronouncing words today. Sorry. And then meaningful use, because you why waste your time and money if it doesn't meet all of this, right? And then, of course, with the implementation of ICD-10 CM, and that really kind of made a difference too. Well, let's just say ICD-10 period, because there's also PCS. And for those of you who do not know yet, ICD-10 is what we use for medical coding. Okay, CM is the clinical modification, and we use that for diagnosis coding. Health plans, Medicare provided consultation assistance to small physician practices through the doctor's office quality information technology program, and that ended in 2008. So this has been a very, it's taken a lot of time for an electronic health record to be to come into play, okay? And then we had Blue Cross Blue Shield and commercial plans use incentives such as pay for performance or pay for quality. And that, of course, is when you talk money, that's always a form of encouragement, right? Healthcare professionals. Many physicians may not be interested in an electronic health record. The mobile devices may be the first step toward implementing technology. Another early step is e-prescribing, and I think they'll like that convenience if they haven't started that already. Nursing and allied health professionals seek organizations with an electronic health record. Really, they make things a lot easier than paper records that can be very time consuming, bulky, and difficult to maintain sometimes. Patients. Until now, patients have had very little interaction with an EHR. Okay, the patient may be concerned about their privacy and security, and many organizations are educating patients on the EHR. They may allow their patient to generate information in the EHR. They could schedule appointments, pay bills. They have educational materials that they can post about either the patient's diagnosis or a surgery or things like that, where they can look at that. They have informed consents, and they can enter health history, and they can also have e-visits in certain organizations. And with that said, that's going to conclude our lesson for today.